Good afternoon. Now we will perform a Clinitest confirmatory test for reducing sugars in urine. This test is used after glucose has been documented as being in a patient's specimen. In order to verify that it is indeed glucose and not another reducing sugar, you will perform this test. In your lab notebook, you will have the directions for performing this test and a comparison color chart to use. You will need distilled water and a pipette for that distilled water, the patient's correctly labeled urine specimen, and a pipette. You will need a test tube rack, a glass test tube appropriately labeled. You must use a glass test tube because this reagent test generates heat and you do not want to hold it. You need a timer that can measure 15-second intervals, and you need the Clinitest reagent tablets. It's very important that you check the expiration date on this and that you make note of whether or not the tablets are discolored or if they're sticking together. These tablets are stored in a light-proof bottle. The lid must be kept on at all times when you are not dispensing a tablet, because any moisture or light will cause the tablets to disintegrate. The first thing you're going to do is to remove the lid to the urine container. You are going to set it upright, and this was a fresh specimen. If this specimen had been stored in a refrigerator or had been sitting on a countertop for any period of time, then you would have had to swirl to mix it. You're going to take a pipette, depress the bulb on the pipette in order to draw up the urine. Cap the specimen in case it's needed for later use and set aside. You will dispense 5 drops directly into this tube and make sure that your pipette is upright so that each drop measures the same. The rest of this will go back into the container. Next, you will remove the cap to the water container, once again storing it upright. This time, you will dispense 10 drops directly into the tube, holding the pipette upright. Now you will take 1 Clinitest tablet, shake it out into the lid, and drop it into the container. Watch while the reaction takes place. You don't shake the test tube during this time. Note that it starts out as blue, it's foaming, it's producing a lot of heat. You will let it react for 15 seconds without touching this, and then after 15 seconds or until the boiling has stopped, you don't shake it. At the end of that period of time, then you will gently shake the test tube and you will compare it against the color chart.